At VSS, we understand leaving your pet here for a procedure can be emotional and sometimes can be filled with anxiety. We often get questions asked at reception, have you got all of my pet's medical records? Have you got all of the medications that you need? Is someone going to be looking after my pet every hour of the night? So we thought we would take you behind the scenes of our specialist hospital.
Pets are referred to us here at Veterinary Specialist Services much in the same way that you may be referred to a human specialist from your GP. Here at Veterinary Specialist Services we have a number of specialists in different disciplines.
At admission, we confirm the patient's details and what procedure they're in for. We also check with the owners what medications they're on and if they have any allergies. We then put an identifying collar on the patient and bring them through to the hospital.
Patients are then settled into hospital and their procedures and plan and medications are all then set up in SmartFlow.
The hospital is where the patients recover from their procedure.
Our hospital nurses are here to make sure all your pet's needs are met. We are constantly liaising with the clinicians, and should there be any complications, we will be in touch with you immediately.
Every patient is kept in a temperature-controlled environment depending on their needs. This is regularly monitored, and we also monitor their walks, water, food, pain score, and make sure they're comfortable in their cages, and we even put in toys for the little ones.
Throughout the day there's regular communication between the clinicians involved in a certain patient's care. In the morning at rounds we will go through and discuss the considerations for the day for that particular patient.
Our surgical nursing team have advanced training in anaesthetics, and we regularly liaise with our specialist veterinary anaesthetist. We place our IV catheters, we clip and prep before surgery, and we administer drugs as required.
We have very strict sterility protocols, and in between each surgery our theatre gets a full clean.
We use a lot of checklists, and checklists have been shown to reduce the risk of error and complications in veterinary and human studies.
A lot goes into making sure that the actual procedure goes as smoothly as possible. A patient is never left on their own, and there are multiple teams involved in the process. In theatre, for example, there is a theatre team that ensures equipment is ready and accessible. There is a dedicated technician monitoring the anaesthesia, so there are no distractions for them with other tasks. And a surgical intern assists the surgeon or clinician with every procedure. We are lucky enough to have access to the latest in terms of facilities and equipment. We are regularly performing MRI, CT, fluoroscopy, radiographs, endoscopy and minimally invasive surgical procedures.
The plan is discussed in theatre as to how the patient needs to be recovered and monitored for the following hours and overnight. This includes discussing pain relief infusions and medications, special recovery requirements, and all other aspects of their immediate care. The surgery team and hospital team also have a detailed handover during recovery.
As the animal emergency team, we are trained in emergency and critical care, and we take care of the VSS patients overnight. When we arrive, we get a thorough handover from the VSS clinicians about your pet's condition, and we develop a detailed plan for your pet's care overnight. And together, we can make sure that your pets are pain-free and there are no problems with their recovery.
We will make sure all of your pet's hospital records will get sent through to your local family vet practice. We will ensure you know how to do your part in the process by providing you clear discharge instructions. We do love taking care of your pet, but seeing you reunited at discharge is our favourite part of their journey. At VSS, our team are dedicated to providing the best possible care for your pet at every stage of their journey through our hospital.